evening. Good to have you with us on this edition of the Urban Debate. We've been continuously, relentlessly tracking the oxygen crisis, the oxygen shortage that we are facing in many parts of our country amidst this second wave of COVID, viewers. And the situation doesn't seem to be improving on ground. So tonight we decided we are going to sit here and hash out what could be possible solutions. Why are we not treating this as if it is a war-like emergency? For all the times that the governments have spoken about going on war footing, are we not realizing that that is exactly the kind of response that we need right now to tackle this oxygen shortage? And I'll give you one small example as to why I believe that needs to be done. This is an example of what's going on in the national capital, in fact, in the NCR region. Hospitals there are literally on a hand-to-mouth basis when it comes to oxygen. Every few hours, you will see a bunch of hospitals raise the alarm. And they are all raising this alarm now publicly. They're using social media to put out this dire situation, the information about this dire situation, asking for help. Not only that, they're now repeatedly going to the Delhi High Court for help because it doesn't seem like anything else is working. Max Healthcare again today said that we are awaiting promised fresh supplies. Over 700 patients admitted. We need immediate assistance. NK Super Specialty Hospital in Delhi said we have 3 hours of oxygen left. 92 COVID patients in the hospital. At least we need 125 to 150 cylinders. Batra Hospital, we have just 30 minutes of oxygen left. There are 352 COVID patients. 42 are in ICU. Akash Healthcare said we received oxygen that will last only 14 hours and then we will need it again. Sir Gangaram Hospital in fact said we have oxygen that will only last a couple of hours, and Gangaram Hospital has been repeatedly highlighting it, even gone into the details of how they are now resorting to other methods, including manual ventilation. Can you imagine that? Because they've run out of oxygen supply. And this list of hospitals just continues. Now, it is not to say that they haven't got any oxygen at all. In most of these cases, within the next 2-3 hours, some amount of supply has reached. But it gives you an indication of how the system currently is functioning on a hour-to-hour basis, on a hand-to-mouth basis. Hospitals cannot function like that. They cannot always be monitoring how many patients versus how much oxygen and be running around helter-skelter begging for oxygen. There has to be an organized system if they are finally being given the supply at the end of the day in 2 hours or even in half an hour. Why isn't it happening without them having to raise this alarm? That's because we are functioning on an extremely ad hoc basis. This is just an example of Delhi. I can give you examples from Uttar Pradesh. Equally horrifying stories. Some parts of Gujarat, same situation. Even in Maharashtra, we've got some reports where, the situation has been dire. This problem needs a national, centralized, coordinated, properly communicated operation. We need to have war rooms where we track the oxygen supply, the storage, figure out the transportation, and get it to the people who need it on priority in the fastest manner. It's no more about announcements. It's no more about what is given to you on paper. It is no more about grandstanding. Right now, things are dire on ground. So tonight, we have experts who will join us firstly, obviously, to tell us what's the ground situation. Some of them, how are they managing it, and some who are experts in handling such administrative challenges, such war-like situations. And I say good evening to Mahesh Zagade, former Municipal Commissioner for Pune, joining us this evening. Dr. Rajendra Bharud, District Magistrate for Nandurbar, Maharashtra, who moved ahead of time, planned ahead in time, and thereby managed to save many, many lives. We also have former Army Chief, General V.P. Malik, joining us this evening. Dr. Devrina Chakravarti, Managing Director and CEO of Artemis Hospitals in Gurgaon, joins us this evening. Rikesh TV, Managing Director of Akshaya Neuro and Multi-Specialty Hospital from Bengaluru, and also Rajesh Kumar Saraf, Managing Director for National Oxygen Limited, joins us. Rajesh, let me start off with you. Can you give us a picture right now of how we are tackling this on a national level. A series of meetings have happened, empowered groups, inter-department, inter-states, but how is it really functioning to ensure that those who need oxygen get it quickly?
Voice is not audible.
Mr. Saraf, Rajesh Saraf, good evening. Can you hear me?
Good evening. Yeah, I can hear you now. Tell me, ma'am. Yeah.
Yes. My question to you, can you give us an insight as to how the national level coordination is right now happening? Ground situation gives us an image that we're really working on an ad hoc basis and hospitals are running around figuring out where they can get oxygen from.
There is as such, there is no shortage of oxygen. The problem is with the turnaround of the tankers and the cylinders, for which the government of India, with the today morning, the meeting which we have had, the video conference meeting which we had with our Honorable Prime Minister, they have given instructions, passed on instructions till the lowest level about creating the green corridor for movement of liquid oxygen tankers, and also for categorizing these liquid oxygen tankers as an ambulances. So this will definitely in the near future will definitely have a quick result about the turnaround of these tanks, because due to COVID impact, there are patients, a lot of patients are there, and the hospitals with whatever infrastructure capacity they have, they are unable to cater to all the patients. So it is about matter of a turnaround of the tankers to refill those tanks, which is a time-consuming process. So with the government support, we are doing our best to ensure that timely supplies are given to the hospitals. And even this is for liquid oxygen, even for cylinders, which has to go to remote places where in the hospitals, small hospitals, they don't have liquid installations. Even those places, the empty cylinders have got to come back, again refilled, again have to go back. So these are some bottlenecks which we are all working 24/7 to ensure that we have a proper and regular supply to the hospitals and the COVID patients.
Yes, and Mr. Saraf, will you be able to give us an understanding of how this is happening? As you are rightly saying, perhaps we are not short on oxygen. There is a problem with cryogenic tankers or not enough cylinders. I understand. But who needs how much and by when? How do we get it to them? From which location? Is it the hospitals themselves who are reaching out to suppliers? Is it the state governments who are reaching out to large suppliers? Or is it being centrally done?
So it is being centrally done. Of course, it is being centrally done. And as far as these tankers are concerned, there are a lot of people, a lot of them are in the process of importing. They have sourced it from all across the world. And tankers are on their way. They are airlifting those tankers. And it will be shortly available. A few tankers are expected to land even this week also and next week also. So everywhere, anywhere available, wherever the tanks are available, the manufacturers are sourcing from those places and importing them, so that we can immediately put them into services. Apart from that, the medical oxygen, we also have some tankers of liquid nitrogen and argon, liquid argon, which also we are in the process of converting into for liquid oxygen. Partly, a few of them have already been converted, leaving a few for pharma industries. The rest, we are all in the process of converting them into liquid oxygen. So definitely, the situation will improve in the day.
Okay, that's on the supplier side. Let me now bring in those who need it the most. Rajesh joins me, Managing Director of Akshaya Neuro and Multi-Specialty Hospital. Rajesh, how is your hospital and many of your peers, how are they managing it? Who do you reach out to when you need more oxygen? How long is the turnaround time?
Generally, earlier, the turnaround time used to be less than a day. Today, I would use this term called catastrophic. We have patients in the hospital who, die because there's no oxygen. One, most of the hospitals are sending off patients because they're not able to manage and there's no oxygen at all. There are two institutes who's trying to give oxygen to most of the hospitals in Bangalore. And I think they're trying to cater about 50 or 60%, if I'm right. Let's say they're trying to probably 95 tons and the requirement is about 150 tons per day. This is exactly what I feel. So it's a very unfortunate situation. People are dying because there's no oxygen. Most of the hospitals today, believe me, in Bangalore, most of the hospitals are not taking patients because there is a scarcity of oxygen. The government should seriously do something immediately before it becomes a disaster.
So, what I'm trying to understand, and thank you for really highlighting, because this is extremely concerning, that the hospitals are unable to take patients, or sometimes are having to discharge patients because you don't have oxygen. And I mean, what could be worse when the cases are on the rise and we're not able to help out people who are now on the footpath, out on the streets, running around. And we had examples from Bengaluru as well that actually showed this story. But Rajesh, I'm again trying to understand this. We are being told that this is being centrally managed, but I see every hospital actually only taking to social media to announce the level of emergency, the gravity of the situation, and in the hope that somebody somewhere is going to help them provide that oxygen. Where is this disconnect then?
See, what is happening is most of us, it used to just be a phone call, let it be Universal or Baroka or whoever, supplying, and they would just come and supply. Today, believe me, you should just go stand in front of these, these companies. There is a beeline of ambulances who want to take cylinders and go. And most of, let's say Universal, I was there a few days back, they are so helpless, they are not able to provide, and they're seriously helpless. And I feel that if the government doesn't do anything, see, we can't leave the patients in the hospital and go there, and the response from there is very sad. They also tell us, sir, we are really helpless, and which is the truth. They're probably trying to satisfy half of what they were trying to do, but still, this is a real helpless situation. I personally was there. I was talking to the director there. He was very generous enough to tell, sir, I'm doing everything possible to help. And I seriously feel this gentleman is taking every effort. But until and unless, I would say, this is what I could understand. If the government can do something about stopping the, there is a huge, I was told, I don't know how far this is true, Bellary alone can feed entire Karnataka, the industry. I think life is more important. We have to first make sure that these oxygen is given to hospitals, and then you can take care of industries. Yeah.
Okay, fair enough, and thank you for being so, upfront in telling us what the ground reality is. I want to highlight the intent is not to spread unnecessary panic, but the intent is to highlight where this seemingly set up system isn't working and failing. So we say we have the oxygen, but it's not reaching the people, the hospitals that need it, and they are not able to treat patients. That's the unfortunate reality. Here is another example that I actually do want to give as I go across to our other panelists as well. Gangaram Hospital. The Gangaram Hospital actually came out with details to say that they had to resort to manual ventilation in certain cases, that they actually saw deaths of some extremely sick patients, which they suspect was because of lack of oxygen. They're running so low on their supplies that the situation has come to this, and they're concerned that there are more extremely sick COVID patients whose lives now hangs in the balance because they're again going to run out of oxygen in some time. Now imagine what's going on in the minds of the hospital and the management and the doctors at that point. They can either sit and calculate this by the minute, or they can actually sit there and treat people, which is what they should be doing. Where are we failing here? General VP Malik, you aren't a medical expert, but you're an expert. You have the experience when it comes to tackling logistics in difficult times, in difficult terrains, where communication and coordination becomes the most important thing. Now, to you, doesn't this look like a warlike situation where we need to go in that kind of a mode?
Thank you, Tanvi. Yes, it is a warlike situation. And in fact, national security also caters for pandemic wars, and that's part of the national security issue today. Wars are a metaphor for mobilization, for action, and for doing something. And I'm not an expert in pandemics, but from the management point of view, I have a few points that I like to mention here. First of all, I think the most important point would be that war are a time for unity. These are not fought by the services alone, armed forces alone, nor by the states of a nation, but by the whole nation. We must remember. And therefore, this is a time for unity and not states versus states or states versus center kind of fights that we keep seeing day in and day out. Pandemics have no boundaries, and we must remember that. Basically, it is a huge logistic challenge at a national level. And we need, I believe, centrally controlled approach, a strategy for pooling of all national resources that we need for fighting this pandemic. All resources, including the oxygen that you just were discussing. These investigations and lessons and all that can come later, but at the moment there is a time for synergy, action, optimism, which is what wins the war. Now, I would like to mention the command and control system that we have in the war. Today it is described as C4I2, which stands for command, control, communications, computers, information, and interoperability. I believe this is what we should be starting all the way down from national level, from Delhi, down to district level. And we should have committees set up of both experts as well as the coordination for coordination purposes. And they should have authorized officers at the center, at the state
yes,
level.
Yes, absolutely. Committees set up with experts who are doing the coordination, bring in the bureaucracy whose job right now should only be this, to bring together the states and work on the same platform, work on the same page. Well, like you very rightly pointed out, General Malik, we seem to be lost in, wasting time in politics and bickering rather than uniting right now. The first rule of a warlike emergency would be to unite like we do in war times. Just one more question, follow-up that I had to this, General Malik. Because this is right now at such a huge scale, and it's emergent right away. We don't have time. We could have prepared in the last 3 months or even 1 year, but we didn't. Would there be any specific advice that you give to the decision makers right now on how to go about the management of it? How do you immediately, in the next 2 days, put a system in place with the war rooms?
Yeah, let's not talk about what has already happened, because we have to look ahead. That is the most important point. So I was talking about these experts committee and the coordination committees, which are required at level right from Delhi, each state and each district. And they should have authorized officers posted with them, whether they are political or administrative, it doesn't matter, people who have that authorization. And their task would be to monitor, to control, and to report the situation. Whatever they can control within their resources, they should be doing that. And if they cannot do that, they must pass the report immediately to the next person. And these have to be handled, these have to be managed 24/7. There is absolutely no doubt about it. They have to be managed 24/7. If they do not have adequate resources, they can take volunteers, they can take NGOs. I'm sure there is no dearth of people from the NCC, civil defense, etc., etc. All those people would be happy to come and help in such a situation. And thereafter, they go into the requirements, and those detailed requirements I do not wish to mention here. I'm not a doctor, but most of the people are saying there is a requirement of oxygen, there is a requirement of additional beds, there is a requirement of ambulances, there are all kinds of requirements are there with the kind of casualties that we are seeing day in and day out. So basically, we must correct our command, control, computer, communication, intelligence, or I would say information and interoperability. There's one more point I wish to mention, Tanvi, and that is that it is the pandemic is spreading panic. We must control that panic, and we should have a system where we can pass on information, use our information strategies to set up again control rooms which can pass information to people and restore their faith in the system. That is also important. So these 3 points, I think, firstly, unite as we do in war. Second, set up a right system which passes the information all the way from down to the top. And the third is do not permit panic to spread.
Thank you so much, General Malik. Especially for the third point, to ensure that we don't spread panic, there has to be exhaustive communication so that people know, so that the hospitals are able to communicate, get the response, get the oxygen. People know what's going on, that, what is the level of preparation, and that communication needs to come from our authorities at every single level. Let me go across to Mr. Mahesh Zagade. Mr. Mahesh Zagade, is it such a difficult task? What is being listed out by General Malik? Can we not get into this warlike mode, organize these control rooms and coordinate at a national level?
Tanvi, I fully subscribe to the views of General Malik, but it is more than that. I wouldn't consider this just a war. It's a huge, humongous kind of war. And the situation is, he's put it very mildly, but it's developing into very serious and it could further develop into a catastrophe also, if not contained properly. Now, there are 2-3 things. We are talking about the oxygen and other supplies, that is inventory management. If you are talking about inventory management, probably the country is doing very well because of the kind of technology that we have. Of course, it can be improved. But the essential part remains, and which is neglected, is that what capacity do we have and whether we can cater to the increasing patients' demand. So there is a big gap. And if this kind of surge continues for even for a few days, then we are leading to a very serious issue. My point is that, see, in government, the trained bureaucracy, especially IAS, IPS, and the civil people, they are trained in this thing, they're experienced, very well meaning. But the kind of killer's instinct to kill this killer virus, that doesn't appear to be there, prevailing in the country. Probably there could be some issues involved. But now the time is not, we still have some time. What we need to do is, see, bureaucracy is trained to have 3 things: anticipate, plan, and implement. We have failed to anticipate that how many patients would be there and how much oxygen would be needed and whether we have that much oxygen. We failed to anticipate. Then we could not plan and have these capacities established, and now the implementation is taking a drubbing. My point is that this is still doable. In what way? We cannot. We are now concentrating on what is the capacity of oxygen, whether we can jack it up, we can import, and all these things. See, this is a very serious thing. Pandemic is not the disease to be controlled by doctors. Pandemic is the disease to be prevented by the management of the governance system. I would say that, going by my experience of swine flu containment in 2009-10 in Pune, 90% efforts of governmental machinery has to be deployed for containment. Today, if you see, we are all talking about remdesivir, tocilizumab, oxygen, and all these things, but the patients are increasing. The country should have a plan to stop this spread in its track, and how it could, when it is possible to do it. Very simple. I will give example of Bombay has got, or Pune, we'll take example of Pune has got 42 lakh of population. Commissioner there cannot sit at this state headquarter and control it. My suggestion was that, and I have been telling this for last 1 year, how it could be done. You divide it into smaller geographical areas, like say, for example, ward offices. So 42 lakh into 164 ward offices is just 26,000 of population. They have got 20,000 of employees. It can be, those can be divided into this 164. And only this 26,000 population can be controlled by 100 staff members. Not just health, but all the governmental machinery has to be deployed there. It's a war. It is not just health, it's a war. So those 100 people can control that. They can have societal engagement. What is missing in corona containment is societal engagement is absolutely missing. There is nothing like the political parties are also not there. I would suggest that like during the election, on the election day or even prior to that, every booth has political parties representatives sitting there and coordinating the things. Why can't we consider this? Why can't all the political parties go to the booth level of 1,000 to 1,500 voters, organize them, do handholding with the administration, and stop this spread? Now, last point I'm going to make is that when the patients require oxygen, when they are serious. Why they are serious? Because initially they don't go to hospitals, they don't to doctors, they don't seek the medical assistance. My point is that if these people are tracked, counseled initially by government machinery, then most of these people would not require hospitalization or oxygen or for that matter any serious medicines like remdesivir or tocilizumab. So point is that catch them at the initial stages, primary stages, and within 8 days the country can see the change. It's not that like we cannot go on importing oxygen, we cannot go on importing remdesivir, we cannot do this thing. So this is the time that country has to sit together, and I would not blame the political leadership here. Political leadership has given enough powers to the bureaucracy through the Disaster Management Act and Epidemic Act, right up to the district level and person level. What is needed is that now the administrative leadership, bureaucratic leadership, they have to perform. If they fail, then we are not heading towards the disaster. We are in the midst of disaster. People are dying. And this is not just kind of war I can understand, enemy somewhere else. This is enemies here within. And if we fail, it will be bureaucratic failure. I would not say it will be a political failure.
Well, I wouldn't say it's, they're completely rid of any blame. They have a responsibility when they start taking it easy, when they send the message that everything's all right, that our focus is now something else, be it the farmers or the elections or religious events, then you would see some amount of, complacency set in even into the government machinery and the bureaucracy. But, you used a very right phrase, which is anticipating it and preparing, which is what bureaucrats should have done. And I have one example, and Dr. Rajesh Kumar, who is a district magistrate and collector for Nandurbar, actually did that. Perhaps, his own understanding of the virus and the situation helped him to act on time. But Dr. Barud, you decided when the cases began to ease that now is not the time to rest. Now, do tell us, because I think this needs to be an example for many across the country that had we acted on time and prepared ourselves better, we could have saved more lives today.
True. It's famous saying in English, if we prepared during our peacetime, we will shed less blood during wartime. Same thing we had done in Maharashtra. Nandurbar is a small district. And this is district which is basically adjoining Gujarat and Madhya Pradesh. It's a tribal district. And in our district, last year, in a single day, hardly we got highest peak is of 190 cases. Very less number of cases we got actually. And in this scenario, we got 1,200 cases per day. It's like 6 times more cases. And we were completely in this phase of shock. So what we should do? So last year, when I was seeing world news, a lot of many countries like American countries and even Brazil. So all these countries, I was seeing many countries fall short of oxygen just because they are not able to handle the pandemic properly. So there are 6-7 points I would like to share how we exactly manage remdesivir oxygen. And being a doctor, I'm a medical graduate. I have quite understanding of how this virus will exactly act on the person. The first thing we have established is a 24/7 control room. We have less facilities, so we put 3 people, 4 landline numbers. Anybody from any place of Nandurbar, they can call. They want ambulance, they want bed, they want any type of facility, even consultation also, where and when they will get oxygen. Immediately on control 24/7, they can get across the Nandurbar. Second thing, it's in the website. What hospital has which type of vacant beds? So I was just seeing the data. We have 22 hospitals and oxygen, ventilator, ICU beds. We have around 1,243. I was just seeing currently, just 5 minutes back, we have 156 available beds right now. ICU, ventilator, oxygens, and around 1,087 beds are occupied. So anybody can go on the website, they can check. Our people are updating on real-time basis. When a single bed gets vacant, hospital people has to call, our people will call them, and that bed will be showed vacant. So people have option which block they want, which hospital they want. If some hospital is fulfilled, they have another option. And in that hospital, if they are getting some problem, they can immediately call control room. So setting up the control room is the most important thing. Second thing we had done last year, we hardly got around 2,000 active patients at a time. This time we got around 8,000 active patients. For a smaller district like Nandurbar, who don't have a single liquid oxygen plant, who don't have a single multi-specialty hospital, who had not a single refilling plant, it's a big thing. What we had done in the span of 3 months, we brought 27 ambulances from the CSR fund. And we use all other ambulances and put GPS into it. And we made sure all ambulances will be tracked. No person will say it's like an Ola Uber service. You just call our helpline number, sir, I'm suffering from this, I'm suffering from that. Ambulance will come and get you. It's like a 108 service. So that is very important that nobody should stay at home unless and until it's an exceptional situation. Somebody has a good facility at home, he has a separate toilet, bathroom, and he can manage on his own. He has a good medical background. That person only should stay at home. Otherwise, for person in general who are illiterate, who don't know about medical situation, who can't monitor their oxygen, it is utmost important they should be immediately isolated. And believe me, we had done isolation for around 7,000 people. Somebody in the railway coaches, somebody in the schools, somebody in hospital, somebody in the COVID care center, and around 10,000 people are taking actual treatment of oxygen. Somebody are getting simple drugs. So let's say more or less around 15% people require hospitalized treatment. But when they're getting hospitalized, if they are not getting oxygen in the early stage, when they are getting hospitalized in the critical stage, they consume a lot of oxygen. So let's say if the saturation drops around 90 to 85%, they will hardly get 5 liters per minute, hardly require 10 liters per minute. But when the saturation drops below 50%, below 40%, the same person will require 10 times more oxygen demand. So 5 liter person will take 50 liters per minute. It means that oxygen can cater the need of around 50 people. He's consuming it alone just because he was not able to get treatment in the early phase. So isolate everyone and monitor every person. That is the third thing. Control room, website, isolate people. Early oxygen supply. Whenever supply of oxygen goes below 95%, goes below 94%, start with small oxygen. 5 liter, 2 liter, 3 liter. And that person gets supports and he didn't deteriorate. Of course, other medicines are there like heparin, dexamethasone, and steroids. Use of remdesivir is very much restricted only for those patients who are transmigrating from moderate to severe, not in the early stages. So what we had done, we had stopped giving remdesivir to any private distributor, any private pharmacy shop. We asked hospital if any person required remdesivir, you submit a form of 2B in which you put all the details, submit it to civil surgeon. We will see all the details, and based on that, we will ration the remdesivir to all the patients directly, not by pharmacy or not by any other means. So that thing is helping us a lot. Finally, the base therapy is to do just physiotherapy. We have to give heparin time to time. We have to give dexamethasone. A lot of people are using steroid and remdesivir unnecessarily. Remdesivir is drug basically brought in, I think, 2007 or 2010 for hepatitis C. And that drug is antiviral, which is not even helpful for hepatitis C. How can that will be helpful for COVID treatment? So a lot of people have this misgiving. In fact, I was giving my talk on 7th of April. I clearly said, don't use remdesivir unnecessarily. It will just reduce the span of duration of stay in hospital, but it will not guarantee that person will survive. That is most important. Sixth thing is to do testing.
You know, Dr. Barood,
if somebody is able to test person, track them, isolate them.
While a lot of your expertise, Dr. Barood, comes from a fact that you are a doctor, and you know very well when it comes to usage of drugs or oxygen. But I think what really helped, and I really appreciate the fact that you did that, as part of the local authority, man in charge as the collector and DM, that you anticipated what was required when the next wave hits us. whether it was setting up an oxygen plant, whether it was buying in more ambulances, whether it was setting up more beds or putting a system for live tracking and live information distribution, dissemination of this information to people. And I think that's really what is required at every, in every city, in every district right now. Thank you so much for the efforts that you've put and, putting it out. I hope this becomes a lesson for many others. Even after the second wave, we shouldn't assume nothing worse can happen to us. Let me say good evening to Dr. Devleena Chakravarti, Managing Director and CEO of Artemis Hospitals, who's also joining us right now. We'll also go across to Dr. Harish Pillai, CEO of Aster India, Aster DM Healthcare, all joining us. In fact, let me first go across to Dr. Harish. Dr. Harish, we're also speaking to a lot of hospitals. We're speaking to all oxygen manufacturers, suppliers. We're speaking to bureaucrats to try and put together a larger picture of how this situation needs to be dealt on a war-like footing, on war footing, as if we are in this national emergency. Now, could you shed some light on how you and your, hospitals are going about arranging for oxygen? Is there a centralized manner, or are you directly in touch with some suppliers, or is it simply on an ad hoc basis wherever you get your next round from?
Yeah, so Aster India, we are running a chain of 14 hospitals across 5 states. So our presence is in Maharashtra, Telangana, Andhra Pradesh, Karnataka, and the state of Kerala. Clearly, after the first wave, once it waved down, we were always in constant touch with our distributors and manufacturers directly. Right now, even though the case numbers are quite significant in all the geographies where we are operating, we have not found any kind of challenges like what I've seen in your channel and other channels. So we are not facing those kind of challenges because in terms of infrastructure, all our hospitals, we rely on basically liquid oxygen storage systems. And therefore, once the main tank is filled up, you have a comfortable supply of almost up to 10 days. And then it's just a question of restocking it. I must say that at least in the states where we operate, the district administrations and the state governments have been very proactive. And we are also fortunate that the oxygen manufacturers are actually physically located in the territories where we are. So logistically, it makes things much more easier. So at this point of time, we are not facing any such challenges, so to speak.
Okay, but what is largely the system that is in place and what should be the solution is what we're looking at. Let me see if Dr. Devleena Chakravarti can hear me. Good evening.
Good evening. Yes, I can hear you loud and clear. Thank you. Can you hear me too?
Dr. Devleena,
yes,
yes,
can you hear me?
Loud and clear. Your hospitals also struggle quite a bit as far as, oxygen supply is concerned. You were one of those people who took to social media to put this information out. Now, we're trying to understand why are hospitals having to go to courts or even Twitter? Is there no centralized way of informing the suppliers or the government, state or central, and getting your next supply?
So thanks for having me on your show. And let me begin by saying that this is an unprecedented situation which none of us could foresee. And when I say none of us, it's not just administrator, politicians, doctors, and even the common citizen of India. Because the second wave, the virus is more virulent, the infectivity rate is higher, and people are desaturating very fast. So the requirement for oxygen is huge. So there is a huge now demand for oxygen, and oxygen suppliers are not able to meet up with this growing demand. So to give the district administration their due credit, I mean, they are trying, calling, and everything. But the point is, end of the day, the oxygen is not reaching us. So I am a doctor, and my only and the sole job that I do is to save lives. So when the oxygen does not, and we are living on a day-to-day basis, we have large storage, tankers for liquid oxygen, but now the supply is 1/3, whereas the demand has gone up by 5 times more. So we are getting the replenishment, which lasts us only for a day. So if the tanker does not come at night, then the next day all hell breaks loose, and that's how I took onto the Twitter this morning, and I was seeking out help. So the problem is, of course, the demand has gone up. And the second is logistics. And let me tell you, there are a huge number of states and where there are steel manufacturers, metal welding, industries, which have the provisions of liquid oxygen, but they do not have the tankers to get it to the states that require it. So in my opinion, today, it's one nation and one problem. The problem is of oxygen, and we need to fix our surface logistics. And we have to see how we can move from one state to the other seamlessly in those tankers, which, today, for instance, the administration has just provided me 1 ton of oxygen, and they have assured me for another 2 tons, which would see me through till probably 3 a.m., because the demand is so huge. We have networked and we are getting another tanker because the corporates are coming forward from Chhattisgarh. And, but the corporate which was giving us the oxygen did not have the tanker. So we had to try and get the logistic people with the oxygen people and try to get it. So in my opinion, when, the stakes are so high, the doctors are working round the clock, fatigue is setting in, the morale is low because of lack of oxygen. And we have to do what it takes. And I'm not saying, the government or the people are not pulling all stops, but I am at the end user level. And I need uninterrupted supply of oxygen on a day-to-day basis and not run with 1 day at a time. And that's my plea.
No, so I'm also very curious for 2 things that I wanted to ask you. Firstly, your account and your handle briefly was restricted after you put out that SOS tweet about lack of oxygen. Was there any clarity on why that happened and how it got restored? Secondly, you say the administration provided you some supply today. Now, was it because of your social media outreach, or did you also reach out to them separately? Is there a system that the hospitals are now aware they can utilize to get in touch with the administration?
Yeah, the first question, that was a surprise to me because I'm not on Twitter. This was my first tweet ever. I created the account in the morning and the account got suspended. Even I was not sure why. But then what I did see was a lot of, public uproar, and that's how probably it got reinstated. And I will be fair to the administration. It was not because of the, social media posting. They have been on a day-to-day basis, trying their best to do what they can. But end of the day, they have not been able to provide it because the production lines have been, the production line in and around Gurgaon are kind of getting choked. So what I'm trying to say is we have to look beyond Delhi NCR. Chhattisgarh, for instance, I know has surplus oxygen. When people saw my tweet this morning, they said, why don't you start a hospital here? We have no dearth of oxygen, but we don't know how to supply it to you. So the issue is currently high demand and logistics. Let's get these 2 together. And I think in the next 7 to 10 days, this problem will be behind us.
Let's hope so. Let's hope in the next, 10 to 12 days, this problem is behind us. But even in the next 10 days, let's hope that we're able to save more and more lives and you all don't have to go through this daily, hourly trauma of where your next cylinder of oxygen is actually coming from. Thank you so much to all of the panelists for joining us. Really appreciated. Viewers, as you can see, while those working on a central committee, while the suppliers and the manufacturers who've been in conversation with the central government and the states who are now setting up these war rooms for coordination, it's not reflective on ground, be it in Gurgaon or in Delhi or in Bengaluru or any other part of the country. The hospitals don't know what to do when their own supplier runs out of oxygen. Then they are simply taking to social media or reaching out to courts in our country. Because there is no organized way of this. There has to be a method in this madness, and we've not yet cracked it. If we to take the wise words coming in from a former Indian Army chief, then that is what is required right now. A coordinated effort with states and center, let go of their other political issues, come together, we all unite, we get everybody on the same page. Coordination and communication being the other key pillars of how this has to be done. Let's hope we're able to get our act together in the coming days. Thank you for joining us.